Hello everyone, my name is Meenu Sharma, Nursing Department Clinical Instructor in RPIIT Medical and Technical Campus. Today my topic is rheumatic heart disease. What is rheumatic heart disease? Rheumatic heart disease is a chronic condition resulting from rheumatic fever which involves all the layer of the heart like pericarditis, pancreatitis, and is characterized by scarring and deformity of the heart valves. Next definition, the commonest valves affecting are the mitral and aortic in the order. However, all four valves can be affected. Next, what is the etiology of rheumatic heart disease? Group A beta hemolytic streptococcus. Next is rheumatic fever. What is the risk factor? First of all, poor socioeconomic status. People who are poor and belong to low socioeconomic condition are prone to get rheumatic heart disease. Next is overcrowding. People who are living in a slum or damp area are more prone to get rheumatic heart disease. Next is age. It appears most commonly in children between the age of 5 to 15 years. Next is climate and season. It occurs more in the rainy season and in the cold climate. Next is upper respiratory tract infections. Rheumatic fever is an outcome of upper respiratory tract infection with group A beta hemolytic streptococcus. Next is previous history of rheumatic fever. Decline with previous history of rheumatic fever are at high risk to develop rheumatic heart disease. Next is genetic predisposition. Rheumatic heart disease show familiar tendency. Next, what is the pathophysiology of rheumatic heart disease? First of all, any causative agents like group A beta hemolytic streptococcus, the untreated staph throats, then rheumatic fever, then all layer of the heart and mitral valves become inflamed, then vegetation forms, then valvular regurgitation and stenosis, then heart failure. Next, what is the clinical manifestations? Major manifestations are carditis, polyarthritis, chorea, erythema, erythema, margination, subcutaneous nodules. Minor manifestations: fever, weakness, malaise, weight loss, and anorexia. Next is arthralgia. Next, laboratory findings. First of all, positive throat culture for group A beta hemolytic streptococci. Next is elevated acute phase reactions like erythrocytes, sedimentation rate. Next, C reactive protein. Next, leukocytes. Next, what is the diagnostic evaluations? A diagnosis of rheumatic heart disease is made after confirming anti-accidental rheumatic fevers. Next, the modified Jones criteria provide guidelines for the diagnosis of rheumatic fever. Next B part is laboratory findings, elevated ESR values, C-reactive proteins, and leukocytosis. Next ECG and echocardiogram to confirm rhythm problem and structural changes. Next chest X-ray shows enlarged heart rate and heart size. Evidence of group A streptococcal infections like positive throat culture for step A. Next, elevated or rising anti-streptococcal antibody titer. Next, recent scarlet fever. Next, imaging studies are chest roentgenography, in which cardiomegaly, pulmonary congestions, and other findings consist.